Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 15, Calcarea Sulph 1. If you are new to T.S.T, that is tissue salt therapy, viewing parts 1 to 6 is a must, because these videos are for learners actually, those who want to learn tissue salt therapy. As a result, part 1 to 6 contains basic instruction and technical things like potency, dilutions, repetition, doses, how to select doses. These are very technical things. If you do not read 1 to 6 and just read it like this, part 15, Calcarea Sulph 1, you would not follow it correctly. So please, if you are sincere that you want to learn this therapy, then you must read first 1 to 6. Otherwise, you may skip. Salt number Calcarea Sulphurica, this is salt number 3 actually. There are 12 salt. Every salt has got a specific number. This is salt number 3. And Calcarea Sulphurica or Calcarea Sulphuricum, all the same. Part 1. How Calcarea Sulph acts. Acting on serous membrane and mucous membrane, Calcarea Sulph absorbs the inflammatory fluid. Also, it acts on different ulcers including tubercular to remove unwanted non-functional waste from the body. When deficiency of Calcarea Sulph is met up, swollen inflamed pus secreting wounds will soon dry up, heal, and skin becomes normal or natural. Continuous secretion of thick yellow pus stained with blood is one of the red-line symptoms of Calcarea Sulph. Now, the images. This is ophthalmia, ophthalmitis or ophthalmia, that is inflammation of eye. Note the outcome is yellowish discharge. Food ulcer, same thing. Pusy, that is full of pus. Don't read it pushy, something got some separate meaning. This is pusy, pus. There is enough pus, eruptions of scalp, the same thing. This is the medicine. Here it is a serous membrane. Notice it is a heart. Heart has got two serous layer of covering called pericardium. When pericarditis occur, fluid accumulates within these two layers. This fluid is exudative inflammatory fluid. This fluid is absorbed by Calcarea Sulph. That is, pericarditis is cured by this medicine. Similarly, mucous membrane. This is mucous membrane. Mucous membrane, there are so many organs where mucous membrane is. There is mouth. The whole intestines from mouth to anus is covered by mucous membrane. And most of the area of respiratory system is also covered by mucous membrane. There are so much area of mucous membrane. This medicine acts also on the mucous membrane. Guiding symptoms of Calcarea Sulph. Calcarea Sulph acts on swollen inflamed masses or ulcers in two different ways. This is very important. Number 1, to stop secretion of pus from old open pus secreting wounds. Number 2, to heal swollen inflamed masses before they start gathering fluid. Actually, what happens when inflammation occurs? After inflammation comes a lot of blood cells and cells of immune system, and reaction between these two types of cells causes accumulation of fluid, which ultimately converts into pus. These are called inflammatory exudates. So that is being displayed in inflamed masses before they start gathering fluid. Here, Calcarea Sulph arrests formation of pus and heals the inflamed area. That is, they cause an effect which is called nip in the bud. disease was going to be started and Calcarea Sulph nipped it in the bud. As such, it is applied on wounds on first stage along with ferrum pus, because ferrum pus takes after inflammation. This is a first stage. So if you give with ferrum pus Calcarea Sulph, the swollen inflamed mass will be dwindled, will get dwindled, and the skin will be normal, that is cured. And when you are at the second stage, that is inflammation is there, then you have to give it with calimure. In that case, they jointly stop formation of pus, heal the wound, and cure will come. Huge amount of dandruff on scalp, thick scab on wound, and thick yellow pus secretions are two leading symptoms of Calcarea Sulph. Mind this. Thick scab on wound and thick yellow pus secretion are two leading symptoms of Calcarea Sulph. Different types of ulcer wounds on scalp. All this type of severe, rather angry looking skin surface are tackled by Calcarea Sulph competently. If thick yellowish pus or mucus having stain of blood comes out of old type of cough cold, bronchitis, pneumonia, phthisis means actually tuberculosis, chronic inflammatory disease of ear, eye, nose, throat, skin, intestine, rectum, anus, huge boils or carbuncles, or any ulcer wound on the tissue of the body. Mind this, any also. Characteristic is only that there must be yellowish thick pus or mucus with blood stain. Then, in all these cases, Calcarea Sulph is infallible. Whatever may be the name of the disease, you need not be worried about the name of the disease. How big or how gigantic or how peculiar the name is. The name may be anything. There is so many names. There are bronchitis, pneumonia, phthisis, chronic inflammatory ears means otorrhea, ophthalmia, so many in throat, tonsillitis, quinsy, in skin, eczema, or any other thing, intestine, rectum, in intestine, it may be ulcerative colitis, Crohn's disease. Also, it will be partly taken up by this particular medicine. But in case of Crohn's disease or ulcerative colitis, since these are autoimmune disease, in these cases also we need homeopathic medicines along with this tissue salt. Then total cure is possible. For needle-like pain or too much soreness in deep structures such as shoulder joint, knee joint, hip joint, if Calcarea Sulph 12x and ferrum pus 12x are given alternately before formation of pus, these destructive diseases would be nipped in the bud without any complexity. Perhaps you cannot follow the weight of this paragraph. Hip joint disease is one of the very painful and disturbing disease in case of old aged persons. Hip joint disease. The starting of hip joint disease, there is needle-like pain or soreness in the deep structure, and this generally goes on, that is increasing gradually, and in that phase Calcarea Sulph 12x and ferrum pus 12x are the medicine. But when there is formation of pus is there already, then Calcarea Sulph 12x and calimure 12x should be given. Maybe required in higher potency also, 30x, 200x may be there also. But if you give it in starting phase, then the disease will be nipped in the bud without any complexity. Now, mental symptoms of Calcarea Sulph. Now we will go by step throughout from mental to particular areas of various bodies. Various parts of bodies. Mental symptoms of Calcarea Sulph: restless, morose, quarrelsome, timid, obstinate, shy, angry. That is, the person may be of this type. Find faults with others, feel herself insulted, use wrong words, while speaking, starts up easily, always busy with herself, do not look around, cannot tolerate persons of different opinion, thinks that others do not appreciate his or her qualities, so feel much sorry. Fear of going mad, fear of ill fate, mind full of different types of imaginary fears. Mood, polypolar. You perhaps know the term bipolar. Bipolar means only two polar, and polypolar means numerous polarity in the mood. Calcarea Sulph is a polypolar medicine. Eye symptoms of Calcarea Sulph. Inflamed canthi. What is canthi? Canthi is the angular portion of both end of the eye, where eyelids meet. Outer canthi, inner canthi. Twitching of eyelids. Flectinular conjunctivitis. Conjunctivitis, you know, conjunctivitis of the inflammation of conjunctiva. Epiphlectinular means this is caused by some viral infection, just inviting some inflammatory reactions, that is immune system reactions. This is called flectinular. Truly speaking, all conjunctivitis almost are flectinular conjunctivitis, because most of the case infection is viral with swelling of cervical glands. You know, cervical glands is lymph glands around the neck. Deep-seated abscess of ulcer, deep-seated abscess, ulcer of cornea, steamy cornea, pus in the anterior chamber, sensation as from a foreign body, flectinular keratitis, the same thing. Inflammation of keratitis, inflammation of cornea is called keratitis. Cornea lies in front of the iris and pupil. Flectinular, the same thing. The reaction is immune system reaction. After injury to the eye from a splinter. Generalized ophthalmia with thick yellow pus, hypopion. This is hypopion. Hypopion means accumulation of pus in the anterior chamber of the eye. That is to absorb the effusion of pus in the eye after Silicea. Generally, in case of pus, elimination of pus, we generally use Silicea first. But if Silicea partly comes into effect, and thereafter it's not cured, then Calcarea Sulph comes to completely absorb this fluid. Now here symptoms of Calcarea Sulph: deafness with discharge from the middle ear, otitis media. This is otitis media. No, sorry, retinitis. Retinitis. This is retinitis. Retinitis. This you cannot see with the open eyes. This is ophthalmoscopic view of the retina. The retina, this black area is retinitis is seen here. It's a very bad type of disease. Generally, the patient may lose vision completely. It's a very serious disease. In all these cases, Calcarea Sulph is medicine. Hemiopia means when the 50% of the field of vision is damaged, either left side or right side. This is left portion is gone. This is also hemiopia, also covered by this Calcarea Sulph. Now here symptoms of Calcarea Sulph: deafness with discharge from middle ear, otitis media. This is middle ear. This is normal middle ear. This is otitis media, and this is inflamed. There are three small bones called malleus incustapes. When these bones are infected, then it is otitis media. Due to this infection, this is tympanic membrane is perforated. This is the picture of perforated picture of tympanic membrane. This is otoscope instrument. This you cannot see in open eyes. You can open eyes, you can see that pus is coming out of this eardrum. But if you can go approach to the tympanic membrane area, you can see this picture. This is a hole, that is, it is perforated. It is also often mixed with blood. It comes out, otitis media, pus comes out. Deafness of discharge. Discharge means pus. Middle ear, this is called otitis media, number 6. Often mixed with blood when Silicea partly responded. Same thing. Sensitive swellings behind ear with tendency to suppurate, pimples around the ear. These are other symptoms. Now in each image there is a number 1, 2, 3, 4, 5, 6. I have given the same number here. You please correlate. No symptoms of Calcarea Sulph. Cold in the head with thick yellow purulent discharge, often tinged with blood. bleeding from nose, one-sided discharge from nose, edge of the nostril sore. Evaluates discharge from posterior nares. Posterior nares. What is posterior nares? You show this is the nose. If we move along one of the nostrils, we can see there are three turbinates or concha, and these three turbinates. After these three turbinates, there is an internal opening of the nose. This is external nose ring. This is called anterior nares. This is called posterior nares. Posterior nares. So swelling of this earliest discharge from posterior nares. If you simply draw deep air through your nostrils like this, making sound, then something you can got in your throat sometimes. That is mucus coming out of posterior nares. Face symptoms of Calcarea Sulph: swelling of cheek, pimples, pustules, and herpetic eruptions on the face. This is herpetic eruption on the face. Herpetic eruption on the face, and this is herpetic eruptions. This is herpetic. Two herpetic eruptions. Inside lip sore. This is mouth symptoms. Raw sore on lips. This is raw sore on lip. Number 3. This is not herpetic. Herpetic eruption. This. Gum boils. This is gum boil. Dry hot mouth. Tongue symptoms of Calcarea Sulph: tongue flabby with clay colored coating as if piece of dried clay, tasted sour, soapy, acrid, yellow coating at the base. This is tongue 1. Teeth symptoms of Calcarea Sulph: rheumatic toothache, toothache with inside of gum swollen and sore, swollen cheeks, gum bleeds on brushing. Number 2. Gum boils, already this image already shown in last slides. Throat symptoms of Calcarea Sulph: last stage of suppurating sore throat with discharge of yellow matter, that is pus. Quinsy. Quinsy is simply a boil on the tonsil. Severe type of tonsillitis. It is highly painful, and in this case, pus comes out of these tonsils. That is called quinsy, discharging pus. Diphtheritis of the soft palate. Soft palate lies on the tongue. In our mouth, when we touch our tongue above, we get the soft palate, curved palate inside the mouth. That diphtheritis, that is diphtheric inflammation. When diphtheria attacks somebody, there is inflammation of soft palate. That is called diphtheritis of the soft palate. Calcarea Sulph also comes there. Life case: Mrs. Kolani Basu, age 32, mother of two children, health thin, weak, had been suffering from delayed menses and leukorrhea for last 2 years. Generally, menses occurred 2 months and a half after. Ran through 3 days only. No foul odor in both, but thick in consistency. Soles and palms cold. Rheumatic swelling in knees and lower leg. Felt worse from cold, damp places, drenched in rain, in warm room, heat of bed. Felt better in warm, open warm air, bare-bodied. During last 6 months, suffering from chronic cough, occasional raising from greenish yellow mucus tinged with blood, feeling pain in chest during cough. She was given Calcarea Sulph 12x 3 grains twice a day for 4 weeks. After 3 weeks, it was reported cough almost stopped. Swollen condition of knees and legs almost gone. She also gained some extra weight. After 4 weeks, 30x 3 grains only once in the morning for 1 month was prescribed. She was also requested to have her chest x-rayed as early as possible, because issue in the middle area, this type of symptoms, and this is occasional raising, greenish yellow mucus tinged with blood, feeling pain in the chest, constant cough. These are symptoms of tuberculosis. Whether there is actual tuberculosis or not, to confirm, this has been suggested by the doctor. After 3 weeks, it was reported that X-ray of chest of Mrs. Basu showed some ominous shadow. ominous shadow, and she was admitted to government hospital for further follow-up. It may be that she had been attacked with tuberculosis, but our Calcarea Sulph has the power to cure this TB also if it is in the primary stage. If the disease is not overwhelmingly affect the patient, if it is in the starting phase, Calcarea Sulph is sufficient to cure the disease.